early death in Boston. No community has been spared, therefore we have a collective responsibility to address it. At the Boston Public Health Commission, through our Recovery Services Bureau, we have made significant community-centered investments to support those who've been most impacted and save lives. Just last year, we used opioid settlement dollars to establish the Family Overdose Support Fund to provide financial support to families who've lost loved ones. My understanding is that this is the first in this country using opioid settlement dollars, and I think that this is something that we should be proud of. Last year, we also used opioid settlement dollars to fund community-based organizations in neighborhoods like Roxbury and Dorchester with some of the highest overdose rates in our city. The goal there was to decrease substance use stigma and distribute naloxone, a life-saving medication that we're all aware of can reverse opioid overdose. Last year, we also established public health vending machines and kiosks to increase access to naloxone and other harm reduction supplies throughout our city. And in partnership with the state, we continue to support comprehensive harm reduction, including naloxone distribution through our AHO program, and we'll continue to do this work. Through these initiatives, in 2024, more than 23,000 doses of naloxone were distributed in Boston. These and other efforts contributed to a 38% decrease in opioid overdose mortality in our city just last year. Let me emphasize the enormity of that decline, because sometimes people say, well, 38%, how much is that really? In 2024, we noted the lowest number of overdose deaths in the city of Boston in a decade. This is an outstanding achievement because of the work done by many of you here today. I also want to say that we're really focused in on addressing health inequity. In recent years, Black and Latinx Boston residents have been disproportionately impacted by opioid-related overdose deaths. We should all be aware of this. But in 2024, because of significant efforts to engage communities, because of efforts to decrease stigma around substance use, we noted a 60% decline in overdose mortality amongst Black individuals and a 50% decline amongst Latinx individuals. This is so progress has been made, but the work is far from complete. Every life lost from drug overdose is one life too many. Every life saved demonstrates the power of collaboration with many of you here, the resilience within our communities, because it really is about the people with a lived experience, and the strength of our commitment to ending this crisis. As a doctor who cares for people living with addiction, as a public health leader, as someone who has had a family member suffer from addiction, I stand with you. I stand beside you today and every day as we continue to save lives and work towards a more hopeful future. Thank you.